I originally decided to go into the academy because somebody came into our school and she explained to us that it was a great opportunity, and I've always wanted to be in the medical field. So she told us that we could study all these different professions, follow all these different nurses, doctors, nurse practitioners, just to find what we might like.
I decided to apply for the academy program because I knew I wanted to do something in the healthcare field, but I wasn't sure exactly what that was.
I decided to apply because I didn't know what I wanted to do, and I wanted to figure out before getting into college.
I applied because I wanted to see if I wanted to go into the nursing realm of it all, or if I wanted to go in something else like respiratory therapy or somewhere in radiology.
ARMC Academy is a once-in-a-lifetime opportunity for Ashtabula County High School students to learn about healthcare careers. Students rotate through the departments of their choice, working side by side with ARMC caregivers. Daily lunch and learn sessions introduce them to other healthcare opportunities available at the hospital. Students also spend one day at Kent State University and visit Glen Bay.
One of the nice things about the academy was that we were literally able to work with patients. I remember doing diabetes testing, for example, with patients.
It's kind of a fun fact to say, like, what's an icebreaker question? Like, oh, I got to follow nurses and doctors all summer, my junior year. Asking my other classmates, nobody's ever, like, followed people like this, only when you get to, like, clinical phases. So it's really interesting to do that at a high school level.
I remember the surgeries. Obviously, that's something, I think it was a hysterectomy. If I remember correctly, my first one, Michael Jackson was playing on the radio. It was just an interesting time. And it was cool to learn from the doctor. They kind of walked me through all the process.
Her knowledge and what she was learning just blew me away. Her terminology, she was a sponge. She soaked it all up.
Academy students have experiences that deeply impact them. Those experiences can reaffirm their choice of a career in healthcare or show them that they can make a difference in another way. And the value of the mentorship and advice from ARMC caregivers is beyond measure.
Going into the academy, I initially thought I wanted to be a pharmacist. And coming out of the academy and thinking about it more and more, I have figured out that I want to be an ER physician, working with pediatrics.
It solidified that I wanted to go into nursing, just with all of the opportunities they gave you throughout the whole program. The most interesting thing I saw was seeing someone who was near death that they placed onto a ventilator in ICU, and then actually seeing that patient on 2 South a week later, still alive and off the ventilator, obviously, and was walking again.
I really loved working with the stroke patients just because that's such a life-altering event that happens to someone, and they went from can't speak, can't move, can't anything to back to their normal lives.
"120 Ashtabula County High School students have graduated from the ARMC Academy as of 2025. 9 Academy graduates are currently employed at ARMC. In all, more than 15% of Academy students have worked at ARMC during their careers. ARMC Academy also has a positive impact across our region. 70% of students are pursuing their careers or education in Northeast Ohio.
I went to the academy knowing I wanted to be a nurse, knowing I wanted to do healthcare. After that, I ended up going to ATEC, and I was in the pharmacy program because I heard a lot about medication being pretty hard in nursing school, so I figured that that could help me. After ATEC, I became a certified pharmacy technician, came to work here, worked here all throughout nursing school, then finished nursing school, became a med-surg nurse, and then that's now led me to be in the ICU.
Halfway through the academy, I thought I did not want to be in healthcare at all. I was actually thinking about the police academy, but then I shadowed for a day in dental and realized I liked the dental field way more than healthcare field. So now I'm a dental assistant working in dental and gonna further my career to a dental hygienist.
So I was still very, I think, interested in medicine all throughout the academy. I found it fascinating learning about the different departments, all the different options that could be in medicine and in a hospital as well. So I was definitely still interested in kind of pursuing, or at least thinking of that. But what really got me, I think, most excited during the process, and what I spent most of the time almost doing, especially towards the end, was actually talking with the doctors and some of the medical folks about more like policy, insurance policy, for example. That happened to also be the summer that Obamacare was being discussed. I can remember being in the middle of the ICU. There were a handful of nurses and some doctors, and I remember all of them talking about insurance and how insurance should be, or how healthcare should be delivered from a national level. And I remember just kind of thinking how cool this was to actually hear about what things should be like from the people that are doing it on the ground, and getting excited about policy and policy making that actually impacts on the patients that are there. That, in a sense, excited me more than the actual healthcare providing side.
It really gave her an insight to what she decided she wanted to do after high school. She originally kind of had a different plan, and this experience showed her that there were different options for her that she liked better.
The advice that I got from some of the employees that I was shadowing, one of them that stuck out to me was I wanted to go to a big name college, and they were talking to me and saying you can save so much money by going to a school closer to home, even if it's a technical school, and then going on to a university. It actually paved the way of my route.
Not having to pay to do this program is just huge because it saved me thousands and thousands of dollars in college.
What the ARMC Academy is really a huge step up, just from a pure experience, even if you're not going in the medical field or just have a slight interest, just to be able to see that. How many people do we know actually are able to kind of shadow to the level that the ARMC Academy does?
ARMC Academy is administered by ARMC Foundation, supported by caregivers who give their time and knowledge to the students, and funded by the generosity of donors and our community.